I was honored to be one of the co-authors in the SUMA-2 trial published in New England Journal of Medicine. The inclusion criteria for SUMA-2 allowed patients to enroll with relapsed refractory mantle cell lymphoma that had received between 1 up to 5 prior therapies, including chemotherapy, monoclonal antibody, and BTK inhibitor, whether that would be ibrutinib or acalabrutinib or both. No question about it, when a patient with relapse or refractory mantle cell lymphoma has received and failed a BTK inhibitor, the prognosis is very poor. To this end, CAR T-cell therapy seems to be able to rescue these patients, hence has the potential to change the therapeutic landscape in mantle cell lymphoma. Now, if you look at the label for brexucabtagene autoleucel, which is the new name for this CAR T-cell explored in SUMA-2, it states that it's approved for adult patients with relapsed refractory mantle cell lymphoma. So this produces a situation where the label is slightly different than the inclusion criteria for the study. The SUMA-2 inclusion criteria required prior BTK inhibitor exposure, and the label does not mention prior BTK inhibitor exposure. Similar to our experience with diffuse large B-cell lymphoma, after the FDA approvals occurred for Tisagen and Axi-cel, it is fitting altogether that this is a multi-layer, multi-step process, and sometimes it takes a village to bring these novel therapies to your cancer center. You need to factor in all the variables at hand, including age, comorbidities, social support, proximity to the cancer center for monitoring, and availability of a reliable caregiver. Studies are showing us that the CAR T-cells are here to stay when it comes to lymphoma, but there may be some subgroups of patients that may not be able to tolerate this advanced technique. Hence, we always need to continue exploring clinical trials for this rare disease. Again, it is important for me to mention that we welcome KTE-X19 as an addition to the armamentarium that we have for mantle cell lymphoma, but it will not necessarily be a good fit for all patients. Hence, we need to continue to develop all non-cellular options for mantle cell lymphoma. Nevertheless, it goes without saying that we're clearly excited about the results seen in clinical trials when it comes to CAR T-cells.